Namaste and good afternoon. On behalf of Apollo Hospitals, I'm delighted to welcome you to yet another session of our Corporate Health Series. This is Dr. Srinidhi Chidambaram here. This series aims to bring focus on health issues that you, as part of the corporate world, are at particular risk for. We hope this series helps you to function at the peak of your health. Nobody expects an emergency or disaster, especially at the workplace. Yet, the simple truth is that emergencies and disasters can strike anyone, anytime, and anywhere. This session is designed to help you plan for that possibility. What is a medical emergency? It is a serious and unforeseen situation that has been caused by a sudden illness or an injury requiring urgent medical attention. A range of medical emergencies can occur in the workplace, but sometimes it also depends on the type of workplace that you are in and the nature of your work. For example, if you're in a workplace like a construction site, the types of medical emergencies may also include falling from a height or injuries from tools, whereas in an office, it might be more related to health, such as a sudden heart attack or a stroke. But whatever it is, it's always very important to be prepared because early recognition and early treatment often saves lives in medical emergencies. So today we are going to discuss this very, very critical topic that may mean the difference between life and death. I'm honored and delighted to welcome Dr. Nitin Jagasia to this session on first aid and emergency preparedness in the workplace. Dr. Nitin Jagasia is an experienced consultant in emergency medicine at Apollo Hospitals, Navi Mumbai, bringing more than 16 years of expertise to his practice. Trained in England's Wessex Deanery, he served as trauma and governance lead at Southampton General Hospital and later as consultant in emergency medicine at the University Hospital Southampton of the NHS Foundation Trust. Dr. Jagasia has also served as training program director at the Royal College of Emergency Medicine. His focus areas include major trauma, clinical governance, and resuscitation training for adults and children that align with international protocols and benchmarks. A fellow of the College of Emergency Medicine, London, he is affiliated with the prestigious medical associations such as the Royal College of Surgery, Edinburgh, the British Medical Association UK, and the Society of Emergency Medicine India. With a passion for academia, Dr. Jagasia continues to extensively contribute to academic journals and remains actively involved in training programs. Thank you so much, Doctor, for joining us today.
Thank you for the time.
So let's begin by first asking you what some of the most common medical emergencies are that an employee should be prepared for at a work environment, and how can they be addressed?
Can be fairly simple emergencies such as sudden bouts of vomiting or fainting, things like that. Particularly if you're diabetic, your sugar can go down. But then also can be some serious ones, like you mentioned. You could suffer from a heart attack or a stroke. You could have your first fit, or you could be a non-epileptic having a seizure. Here of emergencies that could happen. Some, like I said, could be simple and some could be more serious.
So why is it really important to know what these emergencies are depending on the workplace? And what can be planned or done for this? What kind of awareness should people have?
Well, it's like anything else that we do, don't we? We have a car, service, we do regular checks on it and things like that. So in the cold light of day, because once you have the emergency, there's a normal, anybody would panic. And at that time, unless you've thought about it, unless you've planned for it, and unless you've had some measures, you probably won't end up doing what would be right at that time. So in a medical term, or when we do any kind of first aid training, we emphasize on the term chain of survival. Now, what do I mean by chain of survival is right from when the emergency or any medical illness happens. It could be at work, it could be at home, it could be when you're watching a movie or in a mall. But there'll be an initial responder, then there will be a pre-hospital, whether that's an ambulance or a private vehicle. Then there'll be an emergency response within the emergency department, and then the intensive care or operation theater. So each thing is called a link of a chain. So everything has to come together for you to survive or have the best possible outcome in that emergency. And planning and preparing your workplace would be a crucial link. So if you have all the things and training within your organization, so if something were happen, because it would happen, like you said, it could happen at any time of the day, anywhere. So it's going to happen at some stage. And if you're prepared, then those links would link up and you would get the best possible support and care to minimize the damage done.
So could you give us some examples of how this is done at workplaces?
An ideal scenario, if I were to say, is if we take, say a simple heart attack or a stroke or anything like that. Basically, it starts with the organization thinking about it and having a plan within the workplace. So what you need to have is what we like to call a lifesaver. So you've got a trained person within your building along with a team of first aid responders. So one person could be having advanced first aid skills, and then you could have a team of a number of people that have the basic first aid skills. So anything that happens, then this team, and at least one of them is in close proximity. So they turn up and they do what is required in that particular scenario. Like if they're having a heart attack, they would be able to recognize certain features and say, yes, it's a heart attack, or no, it isn't. In fact, this is what we need to do. If it isn't, this is what we need to do. Along with that, each and every person working should be given and should attend first aid and life support training, because that really is the key, because they start recognizing it immediately. And if someone, in medical terms again called cardiac arrest, so when the heart stops beating, what needs to be done? If the person next to that person can identify it and start that initial management while your first responder or your lifesaver arrives, then the ambulance arrives, and then everything else comes in and they make it to the hospital, they have the best chance of survival. So in a workplace, that would be a plan where actually they've got a lifesaver, they've got first aid responders, and they've got everyone in the organization attended some kind of basic life support and first aid skills regularly, because obviously they are not going to be remembering what they learned last year or a few years ago. So there should be a pattern and some kind of, it's like, I'm sure that in the corporate world now, fire safety is a drill. You have to attend, and there's a calendar to it, and you get marked off by your HR. But you have trainings that you do at that level. So this should just be another one of those which has a calendar and everyone part of it.
So do we at Apollo hospitals conduct such programs, first aid and emergency lifesavers program?
Yes.
Operates?
Yes,
Could you
we do it.
that in a bit of a detail?
Sure. Yeah, we do it for corporates. We've got a specifically designed program for corporates. We do it for community everywhere. Specifically for corporates, there is a program, and we do first aid and basic life support, which is there for, generally it's a one-day session where we can have the entire cohort of people, anywhere between 25 to 30, because we do a lot of hands-on training. So we get the mannequins in, we get all the things that they should be able to use before the ambulance or the medical personnel arrive. And at this time, I'd also like to mention something called the AED. It's called the Automated External Defibrillator. You guys might have already seen it everywhere. It's there in malls and airports. So it's a very, very simple, straightforward device, which is also part of the training. So we get that device and you get a hang on how to use it. Because like I mentioned earlier, when there is that panic, when there is that adrenaline rush, if there's something that you've done, you're more likely to do it correctly, and you'll be more confident of delivering that particular skill and that particular care uh, more respectively. So yeah, we run a full day course specifically for corporates. We call it the Apollo Lifesaver, which I mentioned again earlier. So we can run that, and Apollo being pan India, this can be run anywhere, and now depending on the number of people, in a number of batches for each corporate.
So often, knowing what to do is important, and also in emergencies, knowing what not to do is also important. So could you give us a few examples of common mistakes that people usually make, sometimes out of panic, sometimes out of ignorance, when these kind of emergency situations occur, not only in the workplace, but even at home?
Yeah, so obviously it will depend, but commonly people have a habit of giving somebody who's unconscious something orally. Somebody's having a fit or a seizure, they try and put their hand or put something inside their mouth so they don't bite themselves or hurt themselves. So typically these are the common examples which should be avoided when it comes to that. When we have an accidental burns, then people apply all kinds of things, even to wounds. They may apply some creams or some other lotions or something that they were probably told at home or sometime during their growing up years. So that should be avoided for sure. If you, like I said, if you've been trained, then you would know what you would have, and you should have your first aid kit. And then if you've got trained with your kit, you know exactly what you need to use at that time. Particularly if you have an unconscious person who's not involved in any injury or accident, the best thing would be to have them in what we call a recovery position. That is the safest position for them to be. This is when there is no trauma, there is no injury. If there is an injury, it is best to leave them in the position they are till you get some help. Of course, if you've been trained in first aid, this would change. But for the absolute layperson who doesn't have had the training, non-trauma patients, recovery position, if they're unconscious, that is the safest position. Don't try and give them anything orally. Trauma patients, leave them as they are, as long as they're safe, they're not in danger of getting further injured or something else happening to them. And yeah, avoid to put anything on burns, cuts, unless it's been advised by the medical personnel.
Also, in many of the workplaces, of course, in industrial workplaces, they probably would have some safety cupboard or things like that. But most offices have only very limited medical supplies for first aid. So is there some kind of a resource that employees or offices, managers, leaders of organizations can access to make sure that they are adequately stocked for emergencies?
Yeah, so I mean, having a first aid kit along with the standard medication. So for your routine, you will have pains, aches and pains, vomiting, and things like that, and you would have the usual medicines. Again, in ideal scenario, this should be under the purview of someone trained. So it should be administered. And particularly when medications are involved, they expire after a particular time, and chances are they won't get used that often. So making sure that they have replaced them. Certainly no advice on medical conditions like aspirin or GTN or diabetic medications that can just be given by things that can prevent bleeding. So you've got bandages for fractures. You can have splints, so you can put people into an arm pouch or have some kind of a splint to hold the injured part together. Those would be the things generally that should be available in all workplaces, so they can do that immediate first aid. And like I mentioned previously, is the AED, the automated defibrillator. that certainly should be there, particularly with our current lifestyle, with our current corporate work culture and load. Cardiac events are the most life-threatening, and this particular device is actually the most important device because we can really save a life with that, and it is very, very easy to use.
Another thing is for employees who frequently travel on work. So they often wish to carry some supplies with them, largely medications. So what precautions should people take, especially if they're traveling to locations where such access to medical care may not be present?
Yeah, I mean, it's again, medications, unless they're on some kind of chronic health condition and it's being prescribed. Other than that, you should basically just have some painkillers, something for vomiting, loose motions, and some oral rehydration salts. So, if you get dehydrated, if you're having, most common would be gastroenteritis. So having some kind of an oral rehydration powder, which you can reconstitute and have, those would be the ones. For those with medical illness, it's quite important that you're carrying your medical record of some, obviously not the entire file, but a snapshot or a list of the medications that you're on. And also, something like an ECG or a CT MRI scan, if you've got something done which could have an impact, then just having that, not physically, just a picture of it on your smartphone today. Just having, 3-4 things in your smartphone, which like a list of medications as well as your ECG and maybe some other imaging if that is pertinent. Non-medical, non-chronic health related, just basic tablets such as ondansetron, which will be MSET or for vomiting. You would have antacids, painkillers, and then oral rehydration. That's probably, and also important thing will be an emergency contact number. Yeah. God forbid something to happen, then they know who to call, would be able to, immediately give information about you, personal as well as medical, which could make a difference at that time.
Sure. Also, another confusion that people have when someone has some kind of a symptom, they're not sure, whether this is serious enough to warrant immediate medical care or shifting to the hospital, or whether, this is not so serious. So sometimes even something like a fainting episode, or if somebody has an injury. So how does one conclude, or maybe even a head injury? Is it something that can wait, or is it something that can be treated there? For example, if they have an in-house doctor or something that needs immediate shifting to a hospital emergency department. So what will help people? What are some of the danger signs?
Yeah, so I mean, it's particularly a couple of things that I'll just pick on from what you asked. If I pick on head injury first, so head injury can be quite deceptive at times. Most of the times they are minor and nothing sinister. But there are conditions in which somebody may lose consciousness, regain consciousness, and be absolutely fine. But it could be something really dangerous going on. So particularly with head injuries involved, you need to have a medical assessment. Now, if you have an in-house doctor, that's fine. Anybody who's trained. And in today's world, we live virtually. So having access, again, as part of your master plan, having access to, 24/7 medical service, even if it's a video call away, at least if somebody can have a video call, video assessment to begin with, if there's not somebody present physically, that would go a long way in identifying what you mentioned, whether they need to go immediately to a hospital or whether they can wait or whether something can be done on the bedside side. So certainly a medical assessment when it comes to head injury is absolutely crucial. In-house doctor, anybody medically trained, even first aider who's got some experience should assess and, take a call. When in doubt, absolutely, you need to go to the closest emergency center, which is equipped 24/7, which can look after such things. Coming to fainting, yes, it is common. People do faint with various things. If they've got a history of faint before, and if everything is like that and they're fully recovered, then maybe you could, but again, most of the times I would still recommend a medical assessment. Diabetics feeling low sugar, it may be tempting to just take some sugar, you feel better and stay away, but maybe there's something else going on. So it can be quite difficult. I think by and large, unless you get seen by your first aid trained person, like I said, Lifesaver or in-house doctor, or it's just safer to go to the emergency setup and make sure they say it's all okay and you go back. That would be much safer.
Another thing which happens also increasingly often these days is mental health emergencies, where, there is panic attacks or emotional breakdowns, or there might be something which is actually a mental health related issue, but which may masquerade as a physical symptom, or there's also this own suicidal risk that can happen. So can you share some tips on how, these can be handled in the workplace, how people can support their colleague who might be having a mental health crisis?
Well, in the acute phase, like you mentioned, when if somebody is having a panic attack or something like that, generally it's if you've got a place which is non-stimulating, like a calm room where there is not much going on, not too much bright light, with some water, biscuits, something like that. Ideally with a close colleague. If there's a friend at the workplace, nothing like it. But whoever connects with has a good rapport with that person. Just spending time and just giving them that space without trying to push them too hard or trying to, correct things for them. You just have to give them some time to deal with that. That would be in the acute phase. Otherwise, obviously, looking after each other, looking for signs that someone is on the verge of burnout or they are overreacting to some things, or looking for those subtle signs and just pointing out to them that maybe they need to get some help. Nowadays, there's a lot of awareness around that. And luckily for us, the stigma is going away or almost gone from mental health. So actually recognizing that, plus preventively. So preventively within the organization, having team building and other activities, having a timetable for you in the day, having a routine, and then also building in some down hours. So, where you can go away and have a break from what you're doing. All those kinds of healthy habits that you have, everyone talks about regular exercise, and that would certainly go a long way. What we recommend is 30 minutes, 5 times a week. So having that built into your schedule, either in the morning, end of the day, or whatever time. But all these things would be on the preventive aspects for mental health. But yes, we are more aware now, and we just need to, support each other, recognize it, and look after it that way.
And lastly, I wanted to ask you about natural disasters, which also lead to emergency situations. So this might require some kind of an evacuation drill. So it might be a natural disaster, or it might be a fire, or it might be any other kind of thing that needs a kind of an overall plan, an emergency response plan. So would you like to tell us some aspects about how a workplace could develop this and share it with their employees?
Yeah, so I think when we talk about a natural disaster or a major, some kind of emergency in that proportion, having, again, a responsible officer, generally there's a fire safety officer almost everywhere now, and they tend to be the ones who look after disasters as well. So they are looking at the setup that they have, where their fire exits are, how they would evacuate people, how tall or how many stories are there in the building, whether you've got fire lifts or not. The general advice obviously is if something like that were to happen, you need to take stairs, not take the lift. But overall, having a plan based on your setup is to be a officer And also importantly, you create a scenario where you invite everyone that is there. You create a scenario and evacuate the team from that area safely. And when you do that as a mock, you'll get a lot of findings about what worked well and what else you need to provide within the organization to make it safer if it actually happens. So that is how, we have it in hospital as well, because we could suddenly get an influx of a lot more patients in a very short period of time. And we have a disaster plan, and we run mock drills at least twice a year to test our plan and see how that would go if something were to happen.
Right. Is there anything else that you would like to add, Dr. Jagasia, before we conclude the session?
Sure. The one thing I would, I think I've already said it, but pardon me for repeating, but basically first aid training, basic life support training for every staff, every 6 months, ideally, because you would otherwise forget. In addition to that, having your Lifesaver and team of first aid responders, and then, like we mentioned about mock drill, similar things for your lifeline support. Like, for example, what is your ambulance, where your nearest hospital is, heart-ready hospital, stroke-ready hospital, or just one emergency setup that looks after everything. So actually having that and testing that plan would be what would make your workplace a safe place if an emergency were to strike. So to summarize, having a Lifesaver, having a group of first aid responders, the entire team or every employee having first aid training, and then having a chain of survival through the ambulance to the closest hospital 24/7. That is what would make your workplace a safe place to be. Just forgot, there's a couple of online resources which are very, very good. American Heart Association, AHA, as well as Red Cross Society. They both have online materials, so even people, if it's not being done, the employees can be encouraged to go and do this virtually.
Thank you, Doctor, for bringing that in. So as you have heard Dr. Jagasia say, there are very many different ways in which you can prepare yourself and your staff, your co-workers for medical emergencies in the workplace. But the key is to stay vigilant, take proactive steps, preventive steps, and communicate effectively so that whether it's through training, planning, or ensuring that the workplace has all the necessary medical supplies, has all details of access to the nearest hospital, every little bit is taken care of. And please remember that every little bit matters. Time is also very important in saving lives. It takes only a few minutes to prepare for an emergency, but those few minutes can make all the difference in an emergency situation. So stay safe and stay prepared. Thank you and see you soon. Namaste.